Questions?
Okay, so this is a pretty general question about the body. Um, and so I've come across this idea in a few different places about like the body keeping emotional residue. Some people call it trauma, or Eckhart Tolle calls it the pain body. And I feel like there's a lot of confusion around this, at least for myself, and but probably in like the general population as well. And so I guess I was wondering how important this idea is, and if, I guess for me personally, how much I should pay attention to that. And then I have some other questions about like various techniques as well. And
Okay. All right.
but yeah, let's start with that.
Okay. I think if you look further into the pain body as described by Eckhart Tolle, and he acknowledges that it's something that he's just kind of invented as for ease of discussion, and it's also, I think,
Right.
very useful for folks.
Right.
But it's not I don't think it's so much the physical body, but it's more like emotional habits, little nodules of conflict that exist in one's psyche, and that can be triggered by any number of things: boredom, or somebody else, or seeing the old man again, the husband again, or
Right.
one more time the dog crapped on the doorstep. I don't know, so that's a that's an emotional pain body. Now, there's also no question that the mind body is one unit, and so the emotional pain can get manifested in the physical body in terms of muscle contraction, for example, in terms
Yeah.
of and then there can be habits also of the body, like gastric spasm and irritable bowel or something like that,
Yeah.
or bad posture, or certain aches and pains. And then we have a whole world of psychosomatic illnesses, including uh, physical disorders, right? And I've known people to develop, for example, rashes on their palm, which is, in medicine, that's very, very rare,
Mm.
uh, for psychological reasons, clearly psychological reasons.
Mm.
And any number of other physical ailments. I mean, anyone who says that the body can't manifest the pain or the conflict in the mind doesn't know the body mind. But I think what Eckhart Tolle was referring to was something else, and I could have missed this, right? But I think he's more referring to the those habitual patterns of thought that create emotional turmoil and create pain, anger, bitterness, resentment, all the kind of negative stuff. And I think this was brilliant of him, although I don't think there's going to be a medical or a psychological uh, concomitant to this, describes this as a pain body, and he reifies it. Reify means to make real. And so once you make it real like that, it becomes easier to manage in the psyche. It becomes more like an object. And so kudos to Tolle for this. I think it was a very nice, pragmatic, and useful stepping stone for people. And so follow up to that.
Um, yeah, I guess the the Tolle's idea makes sense. Um, but this the other idea where like the pain and stuff is manifested in the body. So
Well, this would be Freud, right? Freud was all over this stuff. I mean, he called it conversion reaction, and he talked about neurotic conflict. Neurotic meaning just uh, mental, unconscious with conscious, and there'd be conflict, and it would be manifested in some part of the body that was symbolized by the For example, not to get too graphic, but in women in the middle of the last century and before that, it was not uncommon for them to develop pain in the inguinal area, or vaginismus, pain in the vagina, over conflicts around sex, right? And there's many examples of things like that. So people would develop symptoms that were related symbolically in the unconscious to the conflict. Or men would develop impotence, or someone develop and then there's the real thing of, you know, if you're heartbroken, I mean, your heart actually hurts, right? It's really interesting. I mean, it's your chest that, I mean, it's physical pain. Now we're into the realm of psychoanalysis, and that has a huge long history. Well, huge long history. It has a history that goes back to the Greeks, but in the Western world, it goes back to Freud at the turn of the last century, literally about 100 years ago, and there was a lot of work done on these kinds of things: conversion reactions, psychosomatic reactions, and then they changed the name so it didn't offend the patient. They called it something else. They called it somatic body disorder. And if you look at DSM, I wouldn't go past DSM 3 or 4, and I hesitate to even go to those. But there's a lot of descriptions of the different syndromes in which this is a salient characteristic: the conversion of psychological distress into a physical symptom. And so that's a huge world in psychiatry, psychoanalysis, depth psychology. But if you could be more specific, then I might be able to be more concrete.
I guess, how do you recognize? Well, so I'll speak about myself here.
Well, because not too much, right?
Okay.
It's very important. We don't want anything identifiable.
Sure. Well, I'll just say, like, I have pain in my legs a lot, like muscle pains, and like, you know, feels like cramping or discomfort and that sort of thing. And I don't know if it's like psychosomatic like that, like it's some manifestation of something, or if it's from like sitting too much and bad posture or doing sports or that sort of thing. And so I've been trying to like pay attention to it and figure that out. But
that's right, exactly. You become your own detective, right? And you become your own scientist, and you have different hypotheses and you test them out, and then you ask, you know, and this, none of this is practicing medicine, you know, on the interwebs.
Right.
So, of course. But the things you'd want to know are okay. First of all, if someone is an athlete and someone's using their legs a lot, and then they're not using their legs, or the opposite, maybe it's just simple muscle pain because the muscles are having to grow. You know, when you grow muscles,
right,
you rip them. You rip the little myofibers, you know, that
right,
make up the muscle, and then there's usually some soreness as the muscle grows. On the other hand, now just for fun, if I was a psychoanalyst, or if I was practiced as a psychoanalyst, I'd wonder, does this man have a leg to stand on, right? For example. And then you would use dreams, you'd use the unconscious, representations of the unconscious, you'd use symbology, and you'd say, well, what do legs represent for a young man, right? And there's no reason why both of these can't be true. We're complex, to put it lightly, organisms. And there's as we know now, there's literal minds in different parts of the body. There has to be, because they have to solve problems, right? Like the liver or the kidneys. Right. And so I don't know why one or the other wouldn't be why they both couldn't be contributory. But there was a third factor that I left out, and what was that? Can you refresh me?
I'm not sure what you're referring to.
Well, there's body, mind. There's also metabolic. Now that I think about it, if you don't have enough potassium, for example,
right,
you can get cramping in the legs. And then there's a whole list of other things that are possible, you know, like blood clots and things you don't need to worry about. So you look to see if it's symmetrical, then it's not likely to be focal. I mean, it's not likely to be, one blood vessel or one nerve, right? And so again, but the key here is for people to take responsibility for their body minds and their pain bodies, and to investigate it on their own and say, well, wait a minute, could this be, could it be in the brain? Well, if it was in the brain, it'd likely be both legs, right? If it's peripheral, it's more likely to be one leg. So if it's both legs, then it's less likely that it's central. But if you're doing exercise with both legs, or you're lifting weights, for example, then that rule doesn't apply. So it's just like that. But the thing is also, the vast majority of these kinds of symptoms, they will pass with time. And Freud, and not just Freud, but a lot of psychiatric folks would say that it's very important to try and understand these symptoms once you've ruled out all the medical serious problems and all that, because they have symbolic, they're there to kind of to teach. Now, did they go overboard? Maybe. Has that whole body of understanding been neglected? Absolutely. And now we've gone for taxonomy, this is this, and this, and we're going to list the symptoms, and if you have 6 of these and 3 of these, then you get this, right? Or this, and that's just silliness, right? Unless you're in court or something. So for the individual person, forget that and just try and understand, what is the body telling me? Because it's usually trying to tell you something.
Yeah.
Follow up?
So what are some techniques for trying to understand it? Because I feel like at this point I spent a lot of time like observing it and trying to understand it, but it seems like you could do that forever and not get anywhere if you're not doing it properly.
Well, 2 things. One is, I can't, and I don't, because I'm no longer practicing psychiatry, do practice on I just don't do that. And there's a danger of this. This is why it'd be better if you talked about a friend or something. So I don't want to speak to that except in the most general terms. But the second question is, when you say forever, what do you mean by forever? Because for a young person, forever could be something much, much shorter than it is to somebody middle-aged, for example. And so what do you mean by forever?
One can imagine spending your whole life obsessed with some issue.
Right, and one can imagine one's whole life with a pain body.
Right.
And so I'm assuming there's no medical or metabolic or physiologic cause, and all those need to be ruled out. So go see a doctor, go see whatever you need to make sure that there's nothing metabolic or physiologic or mechanical or so. Assuming all that's out, then you've got what's called a pain body of sorts, but it's manifest in the physical body. But I'm not sure that's what Eckhart Tolle meant by pain body, but let's use it anyway. So now you have a symptom and you wonder, well, what does this mean? And I can't, as it says in the Tao Te Ching, those who know do not generalize.
Right.
Those who generalize do not know. So I don't want to go much further than that. But if we had another example that didn't involve you, because that's the kind of thing we'd have to discuss offline, right?
Yeah.
But that's kind of what I can do right now, in this forum or this format. But do you have any further questions? You think that?
I have another general question.
Okay, go ahead. No, the questions are great.
A question on attachment.
Okay, good.
So are bonds the same as attachment, or are those different?
I tell you what, can we start over, because this is kind of a separate subject, and also for the editing, it'd be nice to have the bell. So let's start over now, okay? Question.
A question on attachment. So I'm wondering, I've been thinking about this, and I was wondering, are human bonds the same as attachment, or are they different?
Good. one of the paradigms that's really gained ascendance in the West is the notion of attachment and attachment theory.
Right.
And this started probably with Bowlby, I think it was, who no, it wasn't Bowlby, it was Hoffmann Heinz, or some German guy who noted that when he was walking around his pond, if he did it at a certain period in the baby ducklings or baby geese development, they would imprint on him and follow him around like he was the mother.
Right.
And this was such a huge discovery, right? Although it was probably already well known. You know, we have to rediscover everything in the West because we're too, I don't know, too jingoistic to study what's already been done in the East. But so he noticed that these ducklings, these little birds, would imprint onto him or onto a dog. And so a lot of what you see in the internet, when you see the duck and the dog and they're the best friends and all this and that,
Yep.
that's because they imprinted when they were young.
Yep.
So that's called imprinting. From that came the notion of bonding, and there's most certainly something that does occur between the mother and child, as a paradigm example, in which there is a mutual imprinting or a mutual bonding. Okay.
Yeah.
Now we fast forward, and we get to modern psychology, psychotherapies, like theories and stuff, and we get to attachment, and then someone decides, some bright person decides, well, there's 3 or 4 kinds of attachment. There's secure, there's disorganized, there's anxious, and then there's some other one.
Right.
But the point is that attachment is the wrong word, and it's the wrong construct. There is a reciprocal relationship between the mother and the child, between the boyfriend and the girlfriend, between the teenager and the parents. There's a reciprocity of interaction, and they color each other. So let me give you a perfect example of why it's important to make that differentiation. In the early parts of the 20th century, mothers were blamed. They were called refrigerator mothers because they did not act normally around their autistic baby. And it was thought that the mother caused the autism because she was so cold, right? And this was doubly unfortunate. So the theory was that if you had a cold mother, and she didn't attach to the child didn't attach to her, then that would prevent the child from attaching to her. And this was the root of the child's psychopathology, severe autism. I mean severe autism. And some of them can be very intelligent, right? Some of these autistic kids. At any rate, that's obviously ridiculous, because it's the reciprocity of the interaction. So the mother would reach out to the child and try and interact with the child, but the child wouldn't even make eye contact. The child wouldn't imprint normally, wouldn't bond normally, and wouldn't form a normal reciprocal relationship.
Right.
And so this is why, for half of my life, I've said, we need to get rid of attachment as a construct, and we need to look at reciprocal connectedness as a much more fruitful way of looking at this, because it's not one direction. Oh, the child is attached, or the girlfriend's attached. It's a reciprocity of interaction. And so let's say a person, there's 2 people in a relationship, but one's moving this way, then this one's may move this way, right? Or they may move this way, right? Or they could move this. There's any number of configurations, but they're reciprocal. They affect each other. You can't take anything in this universe in isolation. And so, and that's especially true for human beings if you're trying to understand them or trying to understand yourself. I hope that helps us. I did a lot of YouTubes on this, but they're ancient. But I think they're still timely, because people are still using this attachment theory.
People use it a lot. So I think.
Yeah, that's a real problem, because attachment is just one. It's not even half of it. It's reciprocal connectedness, and just like we learned from the Buddhists, there's no such thing as an independent entity. Everything is interacting with everything, always. And so if you try and isolate something completely, like a symptom in the mind or in the body, and don't include the entire context, then you're going to miss it, right? And you're going to have a partial understanding, you're going to have a partial solution, and you're going to have only partial relief and partial growth, right?
Right.
So thank you for bringing that up. That's a very important point, and we should at some point maybe I should revisit that.
Yeah, I think that'd be useful for people. And a follow up on this: when the Buddhists say avoid all attachments, are these reciprocal connections? Is that part of it, or is that just completely separate?
Well, they'd say avoid cling. It's difficult to translate, but it's like clinging, or being attached to your identity. You're attached to an identity, right? So get unattached from that identity, right? You're attached to your car. Well, sooner or later your car's going to get scratched by somebody in a parking lot. So you might be a little lighter about that. And so it's remember, all this is in translation. It's from the 2nd century at best, right?
Right.
And so clinging, attachment, undue identification with, what they really don't want you attached to is concepts. I mean, you can have the most beautiful mansion in the world, right? That's fine. Just don't be attached to it. Don't make it part of your identity. And unfortunately, that's what people do. They say, well, I'm a rich man, so I have to have a big house and a fancy car. Or I'm a poor man, I have to have poor clothes and not eat any food, right? But in both cases, they're attached to the identity. And what they're counseling is be fluid, be free in this world. Don't be attached to one tribe, one identity. Well, within, oh boy.
So is it useful here? I was
Go ahead.
About it. I was using, in the past, you've used like the animal model to kind of distinguish things sometimes, like how would dogs act, and I've heard stories about like dogs that get depressed and sick after their dog friend dies, or the owner is gone or passes away or something, right? And
Well, okay, those are domestic dogs.
yeah.
Now, if in the wild, yeah, the animals do.
But the dogs don't have concepts, right? Do they?
No, humanized dogs certainly do have concepts.
Really?
Well, they have the concept. Well, they don't have a mental concept, but they're in the present, right? And it's more like an association. So if every time, if I ring this bell and give a piece of meat.
Yeah.
So what would you call that? Would you call that a concept, or would you call that a paired association, or would you call that a memory for a stimulus, right? But by evoking that stimulus, you can then evoke the unconditioned response. But see, that's a conditioned response because it's to a bell or to a red light. Humans can do that to dogs in artificial circumstances. Otherwise, they're just kind of chill. They're just out in the wild like other animals. And if they see something good to eat, they eat it. If it's not good to eat, they don't eat it. If they don't have anything to eat, they go hungry a bit. If they're full, they don't eat, right? So it's very important. Once creatures come in contact with man, then we start to imbue them with some of these constructs. Sometimes deliberately, sometimes inadvertently. And dogs in particular are very, very sensitive to human emotion and moods.
Right.
So, I think we have to differentiate dogs, which were literally bred and selected for their capacity to commune with the human psyche, the human mood, the human. That's why we love them, because they feel with us, and they feel for us. But let's not read too much into that. A lot of that is emotional contagion and conditioned learning. That's an abbreviation of a really interesting topic. But let's keep going. Question?
That's all I had.
Okay. So do you want to do any follow-up for any of these? I didn't realize we had a little time, and then I could drill down on wherever you want.
or still?
Uh, for here, and then yeah, on online for now.
Okay. Let me see.
One thing that we might free associate to is dreams, the interpretation of dreams, because this is where Freud and others have gotten well, going way back before before Western civilization was even thought possible. In dreams, there can be symbols that emerge, and those symbols can represent parts of the body, and they can represent symptom complexes. And there's a language and an intelligence there. Then this is Jung understood this as well, and he understood the symbology also of the Jung, by the way, Jung, Carl Jung. And so there's a whole rich area there for exploration by contemporary people of what was, and this is all fallen out of fashion, by the way, in favor of a strict taxonomy and doing it by the book. You know, okay, well, this is narcissistic personality. Oh, okay, this is obsessive compulsive. I don't know, you know, but instead, there's a whole world in dream symbols in which you can investigate your own psyche and your own body in a way if you set your intent. And so then so intent becomes really important when dealing with a pain body, for example, or dealing with a conversion reaction where your body's developing symptoms in response to a psychological uh, uh, conflict or neurosis, or where there's issues or anxieties around your connection with another. You know, the reciprocal connection that's so vital to all of us. And so all of these things are ripe to be investigated, rediscovered, resuscitated, because we're entering a dark age. It looks very much like we're entering a dark age, scientifically at least, and maybe more broadly culturally. And so it's going to be important for people to be guardians of truth and of insight and of wisdom, right? This is a very important function. Okay, anything after that, or shall we?
No, that's all.
Okay, good. Have a great day, sir.